No matter your age, your plan for retirement can start today. From the News Channel 5 Network, this is the Retirement Report.
Good morning. Welcome to the Retirement Report. I'm Hank Parrott, your host. We're going to be talking about healthcare costs today. This is one of those areas when I have new clients that come in for the first time. One of the questions that many times will come up, in particular if they're looking to retire early, is how we're going to cover healthcare costs. So it used to be that was a thing with employers that was part of retiring. You would have a pension typically, healthcare costs would be covered, or maybe you'll have a premium that had to be kicked in with that, but that's not the same today. In fact, it's very rare. That's not completely unheard of, but very rare that people have healthcare costs covered in retirement, at least through that employer when they retire. So once they retire, if they're under 65, if you're under 65 when you retire, how are you going to cover those healthcare costs? And this is a significant cost, and I've got some research to share with you. One of them is the Milliman Medical Index. This is the 2020 version that came out last year. There'll be a new one coming out this year, and each year we get these studies, and they give us an update as far as healthcare costs in retirement. Another is the Employee Benefit Research Institute, and on this one, this is another one that gets into healthcare costs in this particular study. And then the Nationwide Research Institute, Retirement Research Institute, also has some studies helping us with regard to understanding these costs. This is the thing, and the numbers can range dramatically depending on a number of factors, and I'll go into that with you this morning. One of those being, though, understanding what your healthcare needs are. So, for instance, do you take a lot of prescriptions or not? And that is going to affect your healthcare costs, because that's Part D, which we'll talk about how prescription coverage works under Medicare. There's a lot of gaps there that you would have to fill out of pocket, and this is one of those areas. So you can see costs ranging for a couple age 65, anywhere from $165,000 up to $350,000 out of pocket. That's after Medicare. So by the time you factor in your premiums and other out-of-pocket costs, deductibles and co-pays and things not covered by Medicare, it can be a substantial amount of money. And have you thought of that in regard to your retirement planning and how you're going to cover those out-of-pocket costs? And in particular, long-term care being one of those that, though most people are not going to have need of it, the expense of it can be quite devastating if you do. And so we'll talk about ways that you can cover that and how Medicare works with regard to long-term care. The other thing to think in terms of is understanding in your planning, and I'll talk a little bit about how to prepare financially, of course, for retirement. So healthcare costs just being a piece of that. So think in terms of what we talk about with regard to planning in general. Taking a look at what you have for income, what it is today and what it's going to be in retirement. What do you have for expenses? And on that income, is it going to go up? Or, we factor in typically some type of cost of living adjustment. If you're already on a fixed income with Social Security, or when you are in retirement, understanding that the cost of living adjustments that typically occur with Social Security, in fact, over the last 10 years, we've only had, I think, 2 of those years where cost of living adjustments were over 2%. Now, granted, inflation has been lower, but still, this is one of those areas, in particular, the type of index that's used, whether it's CPI, Consumer Price Index Urban, which is the one typically used with Social Security now, and how that basket of goods that they use, it doesn't necessarily work. There's another measure called CPIE, which is Consumer Price Index for Elderly. And what that gets into is more as you get into retirement age, the types of costs that you're going to have, in particular with higher healthcare costs, how that's going to affect your overall inflation number, if you will, with regard to expenses. So in other words, the things you spend money on in retirement usually are going to be quite a bit higher and how much they go up cost-wise each year than what the cost of living adjustments from Social Security will be. And that's really important to understand. That means that the longer you're retired, and of course we're living longer, so that's typically going to be 15, 20, maybe even 25 or 30 years in retirement, now think in terms of what the effects of inflation over that period of time is going to be. So if you've got your income inching up and your expenses rising much more rapidly than what your income's keeping up with, how are you going to make up that difference? Because what's going to happen, right, is you're going to have to start using more of your savings. I remember having a Ford retiree that came in to see me some years ago, and he had been retired for about 10 years. And one of the things he talked about, he says, you know, when I first retired with my pension and my savings and Social Security, he says, I was able to, you know, easily cover my expenses. In fact, was saving a little bit each month over what I spent. He says, now though, I'm finding that I'm having to dip into my savings and I haven't changed lifestyle. It's just to cover those same expenses. And that's the way inflation can sneak up on you. All right, so you have to have a plan where your money then, right, your investments can grow more than just so where you're going to take money out, but you also have to account for inflation and taxes. So that money has to grow enough to be able to cover those expenses as they increase. So in other words, your money that you're going to draw income from needs to increase sufficient to keep up with those increasing expenses, healthcare being a big one. Having a plan around that then becomes all the more critical. So when we're looking at income, expenses, assets, liability, we factor in inflation, we factor in taxes, rates of return on your money, and the goal being, how do you determine what's the needed rate of return on your money to accomplish your goals and your financial goals in retirement? Basically, first and foremost, we want to be able to attain and maintain our standard of living, our quality of life, no matter how long we live, never have to worry about running out of money, not having to worry about not being able to do the things we want to do as well. All right, and this is where the good planning comes in. Now, to help you with that, if you would like to get this type of plan, if you'd like to see your financial future based on what you're doing today and then share strategies, I can show you how to improve upon that. If you'd like to take advantage of that, all you need to do is call my office. That number is 615-376-5325. When you call the office, we'll get your information. We'll send you out a checklist of things to bring to your appointment with me. And what we're going to look at, right, those income, expenses, assets, liabilities. We take a look at all that. We'll do an investment analysis for you to see how you're currently invested, if there are any real big risk in there, in particular in the next bear market, which some may say we're a little overdue for. In fact, I had a gentleman in just yesterday, and that was one of his concerns. He's like, it seems like we're getting overpriced in the market. It seems like the market's been going crazy for some time. And we had the longest bull market in history. We had earlier this year a bear market that lasted just a matter of months, even weeks actually, and rebounded so quickly, just as it dropped so quickly. I'm not sure if you really count that in the normal business cycle of things. And now that we've got an administration changeover, what effect is that going to have? And that's another big concern. So we're going to talk about these kind of things as well in terms of putting together your plan, address all those concerns, make sure again that you're able to accomplish your goals, and show you with the investment analysis will help you prepare and have some defensive strategy, hedging strategies against the next bear market, while at the same time still being able to get that market return on your money, and determining what is the needed rate of return. How much do you need to make on your money to accomplish all your goals? We'll help you determine that and then show you a way that you can in fact get that type of return over the long haul, and be able to never have to worry about running out of money. So again, if you'd like to get this kind of plan, and by the way, we're going to talk about Social Security, Medicare. We have addressed all these issues in this planning as well at no cost. 615-376-5325. And when you come in to see me, I'll also give you a free copy of my book, 7 Steps to Financial Freedom in Retirement. Okay, you know, one of the things when it comes to healthcare, that's one of the areas, and we're going to jump into that when we come back from this break. But as I'm talking to you about healthcare, we're also going to throw some other things in to help you as well. So first, a break. Join me here. I'll be right back on the Retirement Report.